And Kathy, we do have a question from our audience. Has COVID helped awareness of HAIs in general? And does it help to acknowledge how prevalent they are, or has it distracted healthcare from combating HAIs? And I know we have a whole talk track around what's happened with HAIs during COVID. How do you respond to that?
I think it's distracted us from HAIs, and the rise in prevalence during the pandemic, I think, is the best evidence of that. As far as COVID-19 being a stimulus, if you will, for greater investment, I hope that the messages we've been sending ever since I've been involved in this space and before then, investment in public health, investment in laboratory capacity and capabilities at every level, from the individual institution up through population health, investment in infection prevention resources, staffing, education, that sort of thing. Those messages have largely gone ignored, if you will, at a governmental level. Individual institutions have invested more in infection prevention, and that is when they recognized that HAIs not only were, detrimental to their patients, but detrimental to their bottom lines. They started investing in infection prevention. But that investment at the public health level has been systematically defunded at the federal level because of other priorities. Look at what we invest in military as opposed to public health. And that was one of the reasons I think we did as dismally as we did during the pandemic. We didn't have the resources. We didn't have the feet on the street. We didn't have the diagnostic capabilities. And so I would like to think that investment on the federal level, as a nation, that we will reprioritize public health, and that we will recoup some of that investment and be able to make these changes that we've been talking about for decades now, that will make us more resilient in the wake of whatever the next threat is, whether it's antimicrobial resistance or the next pandemic, or whatever the case may be.